Hello, thank you for choosing to watch this webinar on advanced care planning. My name is Suzie Doe and I'm a registered nurse, and my current role is a clinical educator. I teach healthcare professionals about advanced care planning so they can share their knowledge with the people they care for with the aim to improve their end-of-life care. I'm very passionate that everyone knows what advanced care planning is and is given the information to help them to plan for their future before they become unwell and dying. I've cared and nursed for too many people who have left it just far too late to do anything about, and it's left everyone guessing what they actually want for their care and treatment. So I work here at the St Hospice in Manchester. We're very proud to be one of the oldest and largest hospices outside of London, and we're celebrating our 50th anniversary in this year 2021. Throughout our 50th anniversary, we'll be hosting 50 webinars, each lasting 50 minutes long, and each month we'll focus on a specific theme. We believe that everyone deserves to have the best quality of life possible. We aim to meet the unique physical, emotional, social and spiritual needs of those with a life-limiting illness, and to help maintain their dignity too. We provide specialist palliative care for people with cancer and non-cancer life-limiting illnesses at all stages of their illness. And we're not just focused on our patients either. We recognise it's a very difficult, stressful time for relatives, carers and their friends, and we provide support for them too. We have 3 locations across Greater Manchester, and we can also provide support to people in their own homes in certain areas. And all of our services are free of charge, and the sooner we are involved, the more we can help. So you'll be able to find these webinars on our website. So you can see here, I'll put the link up, www.sah.org.uk, and we've also got a YouTube channel, and it's St Hospice UK, all one word. We're also on social media sites as well, so on all the platforms. You can see our Twitter handle there, at St Hospice. You can find us on Facebook, you can like us, and if you put in St Hospice Manchester UK, you will find us. And then lastly, it's Instagram, and again it's all one word, St Hospice. So it's just really good to keep up to date with what's going on at the hospice. There's always something happening, and there's also lots of resources and support on there that you can access. So you might be wondering, why should I watch this webinar? What's it got to do with me? But I'm glad you are sitting here watching it. Dying usually isn't something we like to either think or talk about, is it? There are so many reasons for this. One reason is that we have to really acknowledge and face up to a painful reality that we're going to lose someone we love, and we don't really want that to happen. Unfortunately, with being human, we're born, and sadly we do have to die. So it's a part of life, but it's something that we find very difficult to think about. However, in the past year of the COVID-19 pandemic, this has changed. We've been reminded daily of how many people have been infected of the virus and died of COVID-19 and of other causes as well. We've had to change the way we've lived to protect ourselves and others from becoming ill and dying of COVID-19. So the infection control measures to prevent the spread of COVID-19 has changed how and the way people have died. So deaths have been unexpected. A very limited amount of people, if any, have been allowed to spend time with a dying person. Communication with our loved ones have been very difficult and kind of all virtual as well. And it's also affected how we've carried out their funerals too. So it's affected how we grieve for someone, all because of the COVID-19 restrictions. So more than ever, it's it's important to think about dying and the care we receive before we die. So this webinar is a beginner's guide to advanced care planning, giving you hopefully an overview of what it is and all the important parts of it. I'll chat to you about the main principles of advanced care planning and other things you may want to consider using the alphabet as a guide. So I'll take each letter as a bite-sized chunk, which you'll be able to stop and start as often as you like. So I'll be giving you information to links and websites, and there's a video which I would like you to look at throughout the webinar, so you can find out more about advanced care planning after you finish watching this webinar. So here we go. So let's start with A. A stands for advanced care planning. So what is it? It's a voluntary process for individuals who can make their own decisions to think about what they want in the future for the end of their lives. So it's preparing for your future, and it's for everyone. Anyone can do this. It's about having the better chance of getting what you want. So, for example, if a person has an advanced care plan and they lose their ability to make decisions for themselves and they're unable to tell people what they want for their care and treatment, the advanced care plan will help to guide their family, friends, health and social care professionals about their wishes and preferences. So essentially, advanced care plan is about what happens before you die, the time leading up to your death. I think I've spoken to a number of people in the past and who don't know much about advanced care planning, and they think it's to do with your funeral. Funeral planning is part of advanced care planning, but it isn't all of it. It's about what you want before you die. Advanced care planning in itself isn't legally binding, but it can include other legally binding documents, which I can tell you about during this webinar. It could contain your wishes and preferences, so which there's multiple things that you can put in. It's the list is endless, but things like making your bucket list, things that you want to do before you die, so making a will and other financial decisions, deciding where you want to be cared for, who to care for you. Like I say, the list is endless. When you start making your advanced care plan, it isn't set in stone, it is a process, and it should be reviewed as often as you want, and it can be changed at any time. So it's about you, and it doesn't matter how insignificant your wish or your preferences may be, it's still important to you. So for me personally, a few of my wishes, if I was unwell or dying, would be for my favourite music or Radio 2 to be playing constantly in the background wherever I was, and for the nurses or the carers to apply my face cream and my lip balm on regularly as well. So my wishes and preferences and yours would be sometimes be called an advanced statement, and that would sit within the advanced care plan. So advanced care plan is small parts which make up a bigger picture. And then lastly, and very importantly, aspect of advanced care planning is that once you've written it down, or you've got different aspects of advanced care planning in place, you must share it with the key people in your life, and I'll explain later in the webinar who these key people are. So to make sure that they know what you want when there comes in the point in your life where you're not able to make your own decisions. So I can't stress enough, share. So A also stands for Advanced Decision to Refuse Treatment. Also, you might hear of it called an ADRT. Previously known as Advanced Decisions and Living Wills, and some people may still call them that. So if there's a medical treatment that you don't want, you need to make an advanced decision to refuse treatment. It is a decision you can make now, to refuse a specific type of treatment at some time in the future, such as cardiopulmonary resuscitation, also known as CPR. So it's important to discuss the options with a doctor or a nurse who knows your medical history, and it's only used if at some time in the future you lose the ability to make your own decisions about your treatment. This is one of the legally binding documents. It needs to be written on a valid form, signed by you and by a witness as well. So to refuse a specific treatment, it must state that you are aware that your life is at risk, even if you don't have that treatment. You can only refuse medical treatments, and you just can't request them. So advanced decisions to refuse treatment can be included, like I say, in your advanced care plan, and it will influence the care that you wish to receive in the future. So A stands for advanced care planning and advanced decision to refuse treatment. So B stands for best interest decisions. So these decisions are made for or on behalf of a person who cannot make their own decision, and it's known as well as lacking mental capacity. So after weighing up benefits and burdens of available options, medical and social care staff would come to a decision that would put your best interests at the heart of their decision, but they can only make the right decision for you if they have that information. So advanced care plans will help the health and social care professionals make better judgments and decisions for you if they actually know what your wishes and preferences for your care. B stands for best interest decisions. So moving on to C, and this C is actually got two aspects to C, and both really quite important. So first one, C stands for capacity. So having mental capacity means being able to make and communicate your own decisions. So the Mental Capacity Act 2005, also known as MCA, is designed to protect and empower people who lack the mental capacity to make their own decisions about their care and treatment. And it applies to people aged 16 and over. So it covers decisions about day-to-day things like what you're going to wear, what you want to buy from the shop, to serious life-changing decisions as well. So whether to move into a care home or actually have major surgery. So examples of people who lack capacity, who possibly could lack capacity, include people with dementia, a severe learning disability, a brain injury, people who've had strokes or are unconscious caused by an anaesthetic or even in a sudden accident. So just because a person may have one of these health conditions does not necessarily mean they lack the capacity to make a specific decision. Someone can lack capacity to make a decision, for example, to decide on complex financial issues, may still have the capacity to make other decisions. For example, to decide whether to buy a packet of crisps at the local shop or not. So if you're assessed to have lack capacity, and you had an advanced care plan in place, this would inform your family, your health and social carers, what your wishes and preferences are, and would influence the care you received. So an advanced care plan can only be made when you have capacity to make your own choices. So if you don't lose capacity, you won't ever need to use your advanced care plan. So it's about hoping for the best, but preparing for the worst. So the second C stands for choices. So if you start to plan what you want at the end of your life early, you will have more chance in the care you receive, and it will give you control over your life even at the end of it. Other people like your family, friends and cultures, spirituality, social media and society will influence you and the choices you make, but they are your choices and no one else's. It's really important to involve those close to you when you are writing your wishes and preferences or filling out an advanced care planning document, because it can help them to understand what you want and what's likely to happen to you in the future, and to be realistic about what is possible. So it's really important to be aware of capacity. Just want to repeat again that your advanced care plan will only kind of kick in, you'll only need it if you lose your ability to make a decision, and you can only make an advanced care plan when you have got your capacity, your mental capacity, when you can make your own decisions. So if you lose your capacity and you're assessed and it's deemed that you have lost your capacity for whatever reason, that's when your advanced care plan would work and kick in and help to influence your care. So C stands for capacity and choices. So moving on to D. D stands for document. So your thoughts, your wishes and preferences do need to be written down so it can be shared with others. So you can write and document your wishes and preferences on anything really, on your computer, your laptops, your mobile phones, in a notes section, or writing it clearly on a piece of paper. There's no right or wrong way to document what you want. Different health and social organisations do have their own booklets and leaflets that are structured to help you write down what you do and don't want, such as this one from the Dying Matters website. If you've not heard of Dying Matters, it's led by Hospice UK, and they campaign to create an open culture of that talks about death and dying and bereavement, because dying does matter to us all. So this is their it's called Preferred Priorities of Care, but this is their booklet on advanced care planning, and you can download this from the internet, from the website, and I will give you the link to the website a bit later. So once you've completed writing it down wherever, online, or I forgot to mention that you can actually, there's some websites you can use as well to start documenting your advanced care plan and your advanced statement. You should save a copy for yourself and then give a copy to everyone who's involved with your care. Remember, advanced care planning is not about a particular document, it is a process. So D also stands for DNACPR, which is a decision which stands for Do Not Attempt Cardiopulmonary Resuscitation. You might have heard of this term before, and it means whether you want to be resuscitated or not, and is a decision to be discussed with the doctor that is caring for you. Whether you want to be resuscitated or not, you still need to let key people, like your loved ones and your GP and the other healthcare professionals, know of your decision and include it into your advanced care plan. And then you could actually complete an ADRT and make it legally binding decision. So D stands for document and DNACPR. So we're moving on to E. E stands for end of life care. There can be a lot of confusing terminology surrounding palliative care and end of life care. You may have heard of a term called terminal care, which we used to use but no longer is used now really. The term that's currently used is end of life care, which is the care of a person with a life-limiting illness in the last year of life. End of life care is a part of palliative care. Some people think of end of life care as the last kind of hours to days, even to weeks of someone's life, but actually it's up to a year before they die. So advanced care planning is an important part of end of life care. Healthcare professionals and palliative care specialists will ask you whether you have an advanced care plan, or have you even thought about what your wishes and preferences are. You may be thinking, but I'm not ill, I'm not dying, I don't need to think about this now. But it's never too early to start thinking about what you want and sharing this with your loved ones and having conversations with health and social care professionals involved with your care. The best time to start thinking about it is now, when you have time. So E stands for end of life care. So F stands for friends and family. Involving your loved ones in planning for your future care and sharing your advanced care plan is very important. If they know what your wishes and preferences are, they will be able to pass this information on to health and social care professionals who are looking after you, and will be able to help, and this will be able to help kind of go towards any best interest decisions that need to be made. Speaking about from a personal experience, I started having conversations with my mum. She had some long-term health conditions, and I just wanted to know, following my work on advanced care planning, I wanted to know what she wanted in it when she was unwell or if she was dying. She was quite happy to talk about funerals and funeral planning, but we didn't get no further, and then suddenly she became very unwell and ended up in the intensive care unit on our local hospital. Thankfully, she didn't lose that ability to make her own decisions, even though she was very ill at the time. So the doctors were able to ask her whether she wanted cardiopulmonary resuscitation, so CPR, and she said no, she didn't want that. But if she had lost that ability to tell the doctors and the nurses what she wanted, they would have come to me and asked, did I know what she wanted? And actually, I didn't. We hadn't got that far. So I would have been left with, I don't know what she wanted. Did she want to be resuscitated? Didn't she want to be resuscitated? Would I have gone against her wishes? Have I done the right thing? And I know it would have left me feeling really upset and feeling guilty that I actually didn't know what she wanted. And I might have put my own kind of feelings and thoughts into that decision instead of relying on what she could have told me. So actually, by having an advanced care plan, you're helping others, your loved ones, as well as yourself. F also stands for funerals. So I've just spoken about my mum, and I think people do think about their funerals and about what songs. I've got a long list of songs which I need to whittle down that I want to be played at my funeral. And I don't know if it might be an easier thing to think about, possibly. And recently, sadly, we heard that Prince Philip died, the husband of Queen Elizabeth. And he had planned his own funeral for years. He was very specific about his music and reading choices, and even designed his own Land Rover hearse. I mean, we're not in that position, most of us, to do that. But it was good to know that he had actually thought about it. And I think I've heard that he'd been thinking about his funeral plans for about 10 years. Whether he thought about the care he got beforehand was a different thing. But have you thought about what you want at your funeral? Do your loved ones know what you want? So things like, do you want to be buried, or do you want to be cremated? What songs do you want to be played? What poems or readings you want? Is it going to be religious, or is it going to be a non-religious service? So many choices, so many decisions to make. You'll only get what you want if you tell your loved ones, if you think about it and tell them. Otherwise, they'll be left at a very distressing time trying to decide what you'd want at this kind of special time celebrating your life. I've spoken to so many loved ones of people that I've nursed who have died, and when I asked them whether their loved ones wanted to be buried or cremated, they didn't actually know because they hadn't discussed it. So that kind of left them in left them in a kind of predicament of what to kind of decide for their loved one. So remember, funeral planning isn't advanced care planning in its entirety, but actually it's part of advanced care planning, and it can be included in your advanced care plan. So F stands for family and friends and funerals. Right, so we're going to move on to the next couple of letters, and they're both kind of interlinked. So the first one is G. G stands for good conversations. It could be really difficult to talk to your loved ones and people you're close to about death and dying, especially as we don't do it on a daily basis. It's not an easy subject to talk about. Loved ones may not want to talk about it, or they actually might disagree with your choices. So having a good conversation is really important to be able to share your thoughts with your loved ones. So you might be thinking, help! This sounds like a really good idea, but I don't know where to start. So I would talk to your GP, speak to the nurse or doctor caring for you. They'd want to know and could actually help you embark on this journey of planning your future. And they'll be able to explain your treatment and care options and help you to understand how any decisions and choices you make will affect you. They'll also discuss whether or not your wishes are realistic as well. They could also advise you on how to have that good conversation with others. But there is a really good resource. It's a website. Here's the link. Compassion in Dying website. They state on their website, we can help you prepare for end of life, how to talk about it, plan for it, and record your wishes. So they produce lots of booklets, including, there's a really good one called Starting a Conversation, which kind of includes helpful tips about talking to your doctor and those close to you about your wishes, treatment and care. So I would really recommend you looking at this website. Plus also contact your local hospice if you feel happy to for advice, and also look at that Dying Matters website, which again I'll give you the link at the end of the webinar. So G stands for good conversation and H stands for help. Right, so we're going to look at I, which stands for individual. This is really important. Everyone should be treated as an individual with individual needs. So what I would want will be completely different to probably what you want. So we all have different ways of thinking and doing things and goals and our ambitions for life. So remember, your wishes and preferences will not be the same as anybody else, and this applies to advanced care plan as well. What my advanced care plan will look like compared to yours will probably be completely different, but that's fine. That's about being individuals as humans, as living people, even to the end of our lives. We all should be an individual. And you can also hopefully receive individual support and help with planning your future care from your health care and social care professionals, helping you along this kind of journey. So that's I, and that stands for individual. Next is J. J stands for joined up care. So if you don't let your health and social care professionals know what you want, the care that you could receive could be disjointed, delayed, and actually not what you want. However, as long as you share your wishes and preferences in regards to your future care, and you become unwell and you lose your capacity to make your own decisions, your advanced care plan will help guide those looking after you to work together in a timely manner. So J stands for joined up care. So next is K, and K stands for key people. So I've mentioned key people in the beginning of the webinar. So the key people in your life would be your GP. Even if you're not unwell, you don't see your GP, they still are your general practitioners looking after your care. And any other health or social care professional that's looking after you. So that could be your hospital consultant, any specialist nurses, Macmillan nurses, dementia care nurses, social workers, occupational therapists, physiotherapists. It could be anyone like that. They will be your professional key people. It can also include your family members and or friends. They could become a lasting power of attorney for you, or a named spokesperson, and I'll explain these terms to you shortly. So having an advanced care plan will help these key people know what you want, which will hopefully ensure that you get the care that you wish for. But you need to chat and you need to speak to them and share your thoughts and feelings with them, otherwise I won't know. You will need to make sure that they know that where you keep your advanced care plan. Give them a copy. If you decide to keep an advanced care plan on an electronic device, you need to remember to let them all know how to access device safely. K stands for key people. Right, so L stands for lasting power of attorney. You may have heard of this term. The government website tells us what the lasting power of attorney is. So a lasting power of attorney, LPA, is a legal document that lets you, the donor, appoint one or more people known as attorneys to help you make decisions, or to make decisions on your behalf. So basically they'll be acting as if you were able to speak when you're not able to. So it gives you more control over what happens to you if you have an accident or an illness and cannot make your own decisions and you lack mental capacity. You must be 18 or over, and you must have mental capacity when you make your lasting power of attorney. You cannot make a lasting power of attorney if you have not got the ability to make your own decisions. So there's two types of LPA. The first one's health and welfare, and the second one is property and financial affairs. So you can choose to make one type or both, and one person doesn't have to be both. So for my mum, I was her health and welfare because my skills was being a nurse, and my sister-in-law was her property and financial affairs because she worked in the financial sector and that's where her skills and knowledge laid. There is a cost to making a lasting power of attorney, which will be different depending on how you go about making them, either through the government website or through a solicitor. The government website, I think, is £83 per lasting power of attorney document, and I would speak to your solicitor about how much they cost to do it through them. So it's really important to a few key things to let your key health and social care professionals know who is your lasting power of attorney, and who they are. So as it is a legal document, your health and social care professionals and also other financial organisations such as banks and mortgage lenders will have to see a copy of the lasting power of attorney document, and they possibly might need an official copy from you. So you can get copies, official copies, from solicitors, and not a lot of places will not accept photocopies. So if you think this might be a good idea, I might have someone in mind that I wouldn't mind being my lasting power of attorney, but you need more information, go to the government website. I'm just going to show you this now. So go to this website, and it gives you lots of information on how to go about making an LPA on the website, and it also gives the details of the Office of Public Guardian if you need help, or like I say, go to a solicitor. It's really important that you tell your lasting power of attorneys, I think this is most important out of it all, what you want, as they will be making, like I say, decisions on your behalf, and they will be stepping into your shoes. They will not be able to make those decisions if you haven't spoken to them about actually what you want. So write in your advanced care plan who your attorneys are and their contact details is a really good idea. and also where the lasting power of attorney documents are kept as well. So everything should be kind of kept together. So L stands for lasting power of attorney. So M stands for my wishes. So advanced care planning is all about you and your wishes. Your wishes and preferences will be probably taken into account, your loved ones and kind of their wishes as well, and their thoughts and their feelings. So it's important to discuss with them what you would like, so they can be kept up to date and not actually be surprised by your wishes if and when you need to use your advanced care planning. Getting them on board with what you want will help them to be your advocates in the future. So M stands for my wishes. So moving on to N. N stands for named spokesperson. So this is a person you could choose who will be able to tell the health and social care professionals about your wishes and preferences should you lose the ability to make your own decisions, so you've lost your mental capacity. The difference between a named spokesperson and a lasting power of attorney is that the named spokesperson can only pass on information to healthcare professionals, whereas the lasting power of attorney can make decisions on your behalf and will play like a bigger part in your care and treatment. So N stands for name spokesperson. So we're going to move on to O. O stands for organ donation. This is something else that can be included in your advanced care plan. So the decision to whether or not you want to donate your organs after you've died. Organ donation in England has recently changed to an opt-out system. So this opt-out system means that all adults agree to become organ donors when they die, unless they've made it known that they do not wish to donate. So you can still choose whether or not you want to be an organ donor when you die by registering your decision on the organ donation website and telling your family. Your faith, your beliefs and your culture will continue to be respected, but your family will be asked about organ donation when you die. So whatever you choose, it's really important that you let them know, otherwise they'll be guessing what you wanted and making a very difficult decision at an extremely stressful time. So for more information about organ donation and registering your decision about organ donation, please go to this website that I've just put up on the screen, the NHS organ donation website, and that's the address there. So I would recommend that you go onto there and read up more about organ donation. There's lots of information and it'll help you possibly make your decision, and then you can know that you've let the NHS know what you or don't want. So O stands for organ donation. P stands for personalised care. Personalised care means people have choice and control over the way their care is planned and delivered, and it's based on what matters to them and their individual strengths and needs. And personalised care is one of the key elements of good end-of-life care, caring for the whole person. And what I mean by that is we all have physical, psychological, emotional, spiritual, social elements to us as human beings. So personalised care looks at us as a whole and takes all those bits of us into account when they're actually planning your care. So it's a bit different from advanced care planning, as it's about a shared decision making when you do have that capacity to make your own decisions between the health and social care professionals and yourself. And it's kind of like a triangle of shared decision making. However, if you do lose your capacity to make your own decisions at that time, your advanced care plan could influence personalised care, your personalised care, and it would let the health and social care professionals know what you want and what you didn't want. So P stands for personalised care. So next we're looking at Q. Q stands for questions. So I'm going to read out some questions and which will provide information for your loved ones and your key people, your nominated persons, your lasting power of attorneys, and your health and social care professionals. And it's all the information they would need to know for when you're ill or unwell or need the care and treatment in the future. So I'm going to talk to you about some other questions a bit later in the webinar, but some questions to start to ask yourself now. So if you become ill, where would you prefer to be treated? At home, at a hospice, in the hospital? For example, the next one would, what might help you feel relaxed or comfortable should you need to receive care and treatment at home or hospital? Who would you like to look after you? And who would you like to visit you? Number 4 would be who you would like to look after your dependents. So people like your children, your older relatives, you'll be looking after them, and pets as well are really important to us. So who could look after these really important aspects of your life if you have to go into hospital or if you're unwell? And lastly, what would be important religious or cultural needs if you needed to go into hospital or into a care facility? So just to start to think about all this information that could be included into your advanced care plan. So Q stands for questions. So R is next. So it stands for a real difference. Please don't just take my word for it. And I know I'm talking about advanced care planning, but I've seen it in action, and it does work. And I would highly recommend you watching the Open University advanced care planning mini documentary. It's not very long, it's under 10 minutes. I've put the link to it here on the screen for you, and it's 2 women, and they both got life limiting conditions, and they both discuss and talk about how advanced care planning has helped them plan for their futures. And there's one of the ladies' daughters are on there, and they're talking from their point of view as loved ones as well. And it's really powerful, and it really summarises everything I'm talking to you about in this ABC guide to advanced care planning. So R also stands for respect, and respect stands for recommended summary plan for emergency care and treatment. It's a process which creates a personalised recommendation for your clinical care in an emergency situation. So where you are not able to make your decisions or express your wishes. So it's another part of advanced care planning. Again, not everyone's got one of these, but it can be part of your advanced care plan. So this plan can be for anyone, like advanced care planning, and as I said, be part of your advanced care plan. The plan is created through conversations between you and your health care professionals, so with your doctors. But the plan stays with you, and you should be able to immediately, should be available really kind of immediately to healthcare professionals who are called upon to help you in an emergency, whether you're at home or cared somewhere else. So like professionals like paramedics, ambulance crews, out of hours doctors, care home staff and hospital staff. And they will be all better to able to make a quick decision on how best to help you if they see you having a respect form in an emergency. And it's more than just about whether you want cardiopulmonary resuscitation, and it's a bigger view on care in general in an emergency situation. So as I've said there, I've given you, there's more information on the Resuscitation Council UK website where this information has come from. So I would recommend you looking at that website. So R stands for making a real difference to your life, and also for the respect process. So S stands for sharing. To be honest, it's no good putting a lot of effort into thinking about what your wishes and preferences are and writing it all down and then not actually telling anyone what you want. It will be a waste of your time. So you will not get what you want if you don't tell the key people in your life. You must chat to them and share the advanced care plan with them. If you've written or typed or printed it out, you need to keep a safe, accessible place. Find a safe, accessible place to keep the advanced care plan in, and let people know where it is. I think I've said already that it's a really good idea to keep all your important documents together. So if you've got a lasting power of attorney, advanced decision to refuse treatment, your respect form, they all should sit together with the advanced care plan. And you need to tell people, your trusted key people, how to access your advanced care plan if it's on an electronic device. But it's so important that you share your thoughts and your feelings. So S stands for sharing. T stands for think. Think about what is important to you. If you think you may want to make an advanced care plan, you need to start thinking ahead now. It's better to start thinking about your future now whilst you have the time, and not put in a position where you're put under pressure to make on-the-spot decisions. Even if you are still able to make your own decisions in the future, you still need to have that time to think about what you want. There's no time like the present. So T stands for think. U is next, and it stands for understanding. By listening to this webinar, you've made that first step in finding out what advanced care planning is all about, and having this understanding of all the potential benefits that advanced planning can bring, like taking control of your life and not leaving others to make decisions on your behalf, and ultimately giving you peace of mind for you and your loved ones when you are unwell and not able to make your own decisions. So U is for understanding. V stands for voluntary process. I said right at the beginning of the webinar, you don't have to have an advanced care plan. It is voluntary. It isn't a legal requirement, but it is a recommendation that you do have one in place in whatever form you want it to be. Like I say, there's no right and no wrong way of making an advanced care plan, and it can be all sorts of things. It can be just your wishes and preferences, so your advanced statement, to you having the LPA, an ADRT, or nominated spokesman. It could be any element of this. It doesn't have to be all of those things. So if you don't think you're going to have one right now, or it's just not for you, that's fine. But I do hope that listening to this webinar will start to make you just think about what you want in the future, and just to be aware that you will probably start asked by healthcare professionals more and more whether you have one. V also stands for voice. Your advanced care plan will be your voice when you are unable to talk for yourself, if you lose your ability to make your own decisions and lose your mental capacity. So V stands for voluntary process and voice. We're nearly there, near the end of the alphabet. So W stands for work in progress. So developing an advanced care plan is work in process. It is a process that grows and changes over time. What you may want now for your future may or will change over time. It isn't set in stone. Once you've written it, does not mean you cannot change it. You can anytime. It's yours and no one else's. It's a really good idea to review your care plan on a regular basis, depending upon your circumstances. Once or twice a year, every few months, it's how often you want it to. Just remember though, if you want to make changes to any part of your advanced care plan, make sure you update and tell the key people of the changes. So W stands for work in progress. X stands for exercise. So if you're interested in thinking ahead and making an advanced care plan but don't know where to start, try to do this next exercise after watching this webinar. I'll show you 4 questions that will help you to start to think about information that could be a basis of your advanced care plan. So you can pause the webinar so you can write the questions down if you want to. So things that you should need to start thinking about is what's important to me now, what's important to me for the future, what concerns do I have for the future, have I got any fears or worries, and who would I like to be involved in my care. The next step, once you have thought about these things and possibly written something down, the next step would be to have a chat and share this with your loved ones and any healthcare professionals that are involved in with your care at the moment, like your GP. So X stands for exercise. Right, Y. Y stands for you. Advanced care planning is all about you and what you want for your future. Y stands for you. So Z stands for Z's. Sorry, this is a very tenuous link, mainly because I couldn't find a word starting with Z that links with advanced care planning. So sleep on it. There's been a lot of information I've kind of told you about in this webinar. A lot of information for you to digest and to think about. So if you want more help, further information about advanced care planning, like I said before, I suggest you go onto Dying Matters website, and I've put the link on the screen there. Speak to a health and social care professional that you're in contact with. Contact your local hospice if you want, or if you live in the Greater Manchester area, you can contact St Hospice, and here is our email address. You can always send us an email if you need any help. Please don't forget to look at our other St Anne's Hospice 50th anniversary webinars that will be coming out. And I also recommend you looking at the Digital Legacy webinar, which links in with the advanced care planning too. So I hope you have enjoyed listening to this webinar and you've got some information and you've got a bit better understanding about what advanced care planning is. Thank you very much for listening, and goodbye.